What I wanted to start off with is a year from now, as a result of this legislation, I hope to be able to have Minnesotans buy their health insurance on a device like this or on their home computer. The magnitude of this legislation is that 1.3 million Minnesotans are expected to be able to purchase their health insurance online. That in and of itself is not that big of a deal, but what's important is that it will be an online competitive marketplace for individuals and small businesses and entrepreneurs to be able to buy their health insurance in a competitive setting, an apples-to-apples setting, with hopes that they'll be able to find a product that fits their needs and is affordable for them. We're talking about 1.3 million Minnesotans. 1 in 4 Minnesotans will benefit from this. The estimated savings are in excess of $1 billion for Minnesota families. That's an average per family of $490 each annually that they expect to save as a result of the online competitive marketplace or health insurance marketplace that we're proposing here today. The most important or a very important item is that this is bipartisan legislation. We're actually having a meeting over called One Minnesota talking about how legislators need to work together. We're here at the Capitol today to show you that we're doing that. And with that, I'd like to turn it over to my chief author in the Senate, Senator Tony Lourey. Then we'll hear from some other legislators as well, and finally go to Commissioner Schowalter. Thank you.
Thanks, Joe. And being a senator, respecting the decorum of the Senate, we don't use props, so I don't have something to hold up to you and show you. But no, Minnesota has a real proud history of being a national leader in health care, and we have every intention of maintaining that leadership role in Minnesota. And with the Affordable Care Act, we have a really unique and historic opportunity to continue this legacy and actually move Minnesota forward. This bill is just one key component of the Affordable Care Act, and it's the Health Insurance Exchange, or the Minnesota Insurance Marketplace is what it will say in the bill. And we're actually doing a branding thing right now, and we will change the name of that over time. So you will see a few different names. But this piece, the online marketplace where people will come to get their insurance, is going to be a key component of it. And it is our goal that this marketplace work for consumers and be a trusted source where consumers can find the information they need to choose a plan that best meets their individual needs, their family's needs, small business needs. And to get to the core point that I have, the exchange really provides Minnesota with a foundation for the real improvements in our health care system, and it moves us one step closer to being able to achieve the triple aims of the federal goals of improving individuals' health care experiences and outcomes, and improving population-based health, and through those efforts, bending the cost curves and bringing about the real savings in our market for consumers, for families, for businesses, and helps our entire economy broadly. So as we move to implement the exchange, we must always remember the important tradition Minnesota Care plays in Minnesota and the significant strides we've already made in providing more affordable health care for our low-income working Minnesotans, and as well as making progress on our uninsured population. In the 1.3 million that we expect to come forward and get their insurance through the exchange, 300,000 of them are today uninsured. This is a big step forward, again, towards the triple aims. And so unlike many other states, the standard implementation of the Affordable Care Act in Minnesota is really not enough to ensure that we don't move backwards for this important population. So it's critical that we continue to work this session to provide for a policy solution to allow Minnesota to continue moving forward in providing access to quality, affordable health care to every single Minnesotan. And this is really the foundation upon which we achieve those meaningful goals for Minnesota and our people. So with that, I think, and Joe also made it really a clear point that we intend this to be a starting place, this bill that you're getting your first blush of right now. And we're going to have a long and involved discussion. These are important changes in a large market segment of the Minnesota economy, and we're going to have that discussion. It's going to be an orderly discussion, and we're going to work very, very hard to include all voices and make sure that we do the very best job for Minnesotans through that process. And so Julie, if you...
Thank you. Well, a good afternoon, and I think we should be very happy with the two authors that we have here. This bill is in very fine hands, and I'd like to thank everybody that has been involved in crafting this bill and working on this, and the task force that was at hand already, the working group. I was not involved in it last year. I had my hands full on a couple other issues. But I'm anxious to work in a very bipartisan way, because that's how you get things done here. And I know that Senator Lourey will do anything he possibly can to make sure that we are all educated up to the point where he is. Obviously, he knows this bill very well. But it's something that we have to do in a very, very fast fashion. So we will get it done, and hopefully we'll have a bill that everybody will say, you know what, we are keeping our Minnesota health care reform agenda, and we're moving it forward in the way we always have. We are leaders in the nation, and we will continue with this bill. So thank you very much.
Should we just go to Greg and Tom and Jim? Or Tom, Greg, and Jim? Tom is our second author on the bill.
Well, this is a key moment. The fact that we're going to add 300,000 people to the insurance rolls is a huge change. And a lot of people don't know it, but you're already paying for people who don't have insurance. Because when somebody shows up at the emergency room, they don't have insurance, they get treated, they get very good care, but the hospital doesn't get paid. So what does the hospital have to do in order to survive? They raise the rates to everybody else. So we're already paying for these uninsured people. Secondly, I would say that this bill is a key component of the Affordable Care Act. The Affordable Care Act wouldn't work without the exchange. And I personally believe that a lot of things in the Affordable Care Act came out of the Minnesota legislature in 2007, 2008, 2009, 2010. Such things as chronic disease management, medical homes or healthcare homes started in Minnesota, and they ended up, strangely enough, in the Affordable Care Act. So this is, I believe, the most important moment in healthcare history in the United States since 1965, when we came up with Medicare and Medicaid. And this year, you're going to see the biggest change in our healthcare system. It's still going to be in the private market, most of it. It's still going to be the current kind of providers we have, but they're going to get paid a little different. And hopefully we will see a dramatic reduction in the cost of health care. So this is a key moment in my 20 years in the legislature. I think this is the most important year that I will be here. Thank you.
I'm going to pass.
Okay.
I'm going to be a listener today. So.
Okay. Well, you've always been a good listener. Hi, I'm Jim Abeler. I'm from Anoka. And I am here to support the worthy goals of this project. To tell you I'm not a fan of the Affordable Care Act. I did not support it. I did not support the exchange. I was hoping it might change, but it did not. The Supreme Court decided it was fine, and the electorate decided that we would keep things on the track they're on. That being said, I come to you as a pragmatist, trying to make this the best it can be. I've read this bill. I've spent more hours on this project since I got out of session than any other project. And this has an opportunity to be one of the best things in Minnesota has happened to it, or one of the worst things, depending upon how well it's done. It has a chance to help people with lesser costs, or actually increase costs if it's done badly. It's going to cost us some money on the front end. $332 million between the beginning and the end of 2016, both state and federal. $333 million. And so we have to spend that money wisely and make sure we get our value out of it. Having just come through a time of retrenchment in the human service side, $332 million is a lot of money. It buys a lot of services for a lot of people. So we have to take that duty responsibly, and we have an excellent crew up here who are willing to dig in and accomplish that. It has to actually work. This is so complex. If you spent, Senator Lourey would get up for a few minutes and just ramble on about a couple of little details your eyes would glaze over, or some of the department staff at the management and budget. If you listen to April Tadamama talk, it's fascinating, but like, oh my. So it's really complicated. Are the plugins going to plug in? Are they going to actually, when they push the button on October 1st, is it going to work? And so that's why it's important to have a crew like this to make it work. But it's not a done deal, and it's not going to be easy. And so we care about the people it's going to serve. But most of the savings that are going to come to those people are going to come from federal subsidies. As you understand, that's the up to 400% of poverty is going to get a subsidy. It's about $80,000 or so for a family of 4. That's from a government that's spending over 40 cents on a dollar on money it's borrowed. So the whole question I look at is about tenability. And so hopefully the government can keep its promises and they can solve all their Washington matters. And so as we seek to help the people, we have to make sure that those who implement this, which would be the providers, the insurance agents who have to sell products and stay in business, the health plans, and the businesses who have to pay for all this at the end of the day are going to find a product that's worthy of their time. So I'm here to be part of the solution. This is a worthy project if it's done well, and I'm here to make it work. So thank you.
I'm Greg Davids. I represent District 28B, Fillmore and Houston counties. And I am a supporter of the concept of a state exchange versus a federal exchange. Representative Abeler gave a little bit of history. Of course, there were those of us that thought it was not constitutional. It is. There were those of us that thought the country would take a different direction. It did not. And so here we are. And I want to thank Representative Atkins for inviting me into this debate. The way the bill is right now, of course, I have some major concerns that we could talk about in a bit. But as we look at it today, we need to be in the game, be in the arena. My main purpose for wanting to work very hard on this bill is because when someone needs help, I would much rather be calling the area code of 651 rather than the area code of 202. I'm a believer in states' rights. I believe the states do a better job than the federal government does. That's pretty obvious. And so I want to make sure that we put together a system that will work. And as I said, the way the bill reads right now, I do have some major concerns, but those concerns are for another day. And again, I want to thank Representative Atkins for inviting me to take part in the debate. Thank you.
I would, just in closing comments, like to, again, thank the chief authors. It is a privilege to really see the legislature take this important day and move forward with this bill. As you all know, the governor has been working for this day for quite some time, making sure that Minnesota has the option and the opportunity to craft a legislation to its unique marketplace that works for all its citizens. We've had a lot of people working on this. Public input through the Health Exchange Task Force, state agencies from the regulatory side to the public services side. We have all been working together to try and make this day a possibility, and it's exciting to see the chief authors and all the legislators here and all the other legislators that are going to be working on this bill, because it's an important act to keep Minnesota's health care reform going, and it's one that's important to make sure that Minnesota controls its own destiny, so that our healthcare markets work as effectively as possible. I just want to say, with a great gratitude as well for all of the legislators here, because there's a tremendous amount of work to be done on this bill. We've got a great start. We've got some great ideas here. But we know there's going to be a lot of committee work, a lot of stakeholders that are going to want to have additional ideas on it. And that's a good thing, because the governor at the very beginning said this should be a transparent process, this should be an inclusive process, and that's what we're going to get. And in the end, we should have a health exchange and a health place marketplace that's simple, helps people access insurance, that's affordable, and works for them. We're looking forward to that.
And with that, we'd be happy to take whatever questions.
How important is this to small business owners in particular who are going to be looking to the exchange come later this year and early next year for their employees to find insurance?
We anticipate that small businesses will be one of the major beneficiaries of this legislation. The anticipated savings to small businesses in Minnesota alone is in excess of $150 million per year. It's going to have a major impact on small businesses, and part of that point, as we talk about job growth this session and economic moving forward, is that with those savings, we hope the Minnesota businesses will be able to grow their businesses and grow jobs.
They're hoping it will be simple to use. Is that one of your goals, is to make this not a very complex situation for people to have to go through?
I hope to be able to use it, so it has to be simple.
And do you like the steps that have been taken so far with the website? Do you think the way it's looking now, it is going to be easy to use?
I think on behalf of all of us, we commend the exchange folks and the task force for the work that they've done over the past many months. They've done just terrific work to get us to this day where we can talk about trying to find a bipartisan bit of legislation that takes us the rest of the way.
Representative, how much has the tone changed on this issue of opting into federal health care? Because I recall members in your chamber 2 years ago saying they campaigned on repealing Obamacare, keeping the state out of Obamacare. Nobody up here is using the term Obamacare anymore.
It's a big love-in now. Well, I mean, we wouldn't be standing here with Representative Abeler and Representative Davids and Senator Rosen, and there were others among us that had concerns about how the Affordable Care Act was going to come into play. But the fact is we've now got two options. This is either going to be federally imposed upon us as a health insurance marketplace or exchange, or we can do a Minnesota-grown version, and we prefer to do that. All you got to look at is the Tom Huntleys and Jim Abelers of the world have worked so hard to build a system here in Minnesota that's the envy of the rest of the country. The last thing we want to do is cede that authority to the federal government.
Could I ask a Republican to?
I invite Tony to
add to that just a little bit, because honestly, we're still getting used to this new environment, truthfully. And so the tone, I believe, will continue to change as we grow. I mean, one of the really important facts is that those states that are opting not to implement their own exchange are still going to have to pay for it. And it's going to be more expensive than the Minnesota-based exchange that we're proposing today. And so that really does tend to change the dynamic a bit as people start to dig in. And as Senator Rosen said, we're going to be doing our very utmost to be reaching out to everybody and educating them and making sure that we have a really true and honest, open dialogue about what's really going on here. And so over time, I think the tone will continue to change. There will certainly be some stressful and tense conversations along the way, but I do believe that because almost everyone in the healthcare industry believes that a Minnesota-based exchange is the right approach for the Minnesota that is the healthcare leader that we've always been, we will gain momentum and people will come with constructive ideas as we roll this forward. So there's still a little bit of resistance here and there, but I really do truly anticipate a continued waning of the visceral response.
Can you talk a little bit? Can someone talk? Oh, I'm sorry.
Back to the previous question here, I would have to say that it's very important to me that, and I know Chair Atkins, who's a very fair chair, will hear all sides. And I'm very, very concerned about getting buy-in from the chamber, from the NFIB, from small businesses. They will be at the table. I've worked with Representative Atkins a long time, and I know we'll have free, fair, and open hearings. But we have to have buy-in from the business community. We have to have buy-in from small business to make this work. And there's some things in the bill, as I said, to discuss another day that I do have some concerns about. But those discussions are for another day.
Can someone talk a little bit about what's in this bill and some of the specifics as far as this 7-member board? Is it considered a public-private partnership, like the governor had kind of recommended, or is it private? Would you characterize it?
It is a public-private partnership. It's the same that was in the bill that Representative Atkins and I authored last year as well. So it is set up as a public board, and that's done because one of the core functions of the marketplace, the Minnesota insurance marketplace, is to do Medicaid eligibility determinations, and that has to be done by a public entity. So there has to be a fairly solid link with the public. But given that, and through the work of the Exchange Task Force, it also needed to be flexible and able to move in this changing environment and respond to market needs. And so there's a great deal of that flexibility added into this bill. And all of those are issues that will be discussed thoroughly. There are many valid viewpoints about how much flexibility, how much separation from the public does there need to be. But I think that through our work on the task force, it became very clear that a public-private partnership was the right approach to go. I believe 12 states have implemented some legislation to support an exchange, and of those, 11 of them have also wound up at a place where it is a public-private partnership. And so we're very much in sync, largely because of that Medicaid piece that is a core component. And so we're very much in sync with the task force's recommendations and with what other states have determined pretty much needs to be the approach.
Is it the board that's going to decide which insurance plans can sell in the exchange?
In the current draft of the bill, there is the ability for the board to select plans to sell on the exchange. And that is another issue that will need a great deal of conversation, certainly. There are voices among us that think that's not the right approach. One of the core components that we're trying to ensure is that the marketplace actually works for the benefit of consumers and that they're not overwhelmed by the choices. That's one of the things that's of concern, and one of the abilities to approach, one of the options for approaching that would be to make sure that the board has the ability to kind of control the market enough to make sure that the choices presented to consumers are manageable choices and that we're able to manage an apples-to-apples comparison of those choices. Again, robust discussion on that very point will be had in the 7 committee stops, plus the conference committee that will likely occur, unless Joe just adopts the bill that we pass in the Senate.
Well, I was hoping you'd adopt ours.
Oh, okay. But there will be a conference committee.
I think it bears mentioning, though, that the major aim is to have a very vibrant, competitive marketplace.
Yes.
And if it's possible to have lots and lots of plans that can be narrowed easily by a consumer and they can find a product that fits their business's needs or that individual family's needs, that's a great aim. And I look forward. We've actually, Greg was right, we do need to reach out to the business. We met earlier this morning with Chamber of Commerce, another number of the business interests, also met with a number of progressive organizations and patients organizations to give them a little bit of a preview, and we hope that as a result of working well with those folks and keeping the conversation open, we'll end up with the best bill that we can.
Is there any guarantee that everybody gets the same access to insurance so that people in Senator Metzon's district and Senator Rosen's district have the same access, or would rural areas maybe not have as many choices?
And I should let my more rural member, but that's one of the, to me, and I'm just down the road here in Inver Grove Heights, but to me that's one of the neatest parts of this bill, is that you can live anywhere in Minnesota and have the same exact access of anybody living in the Twin Cities metro area.
Well, one of Commissioner Schowalter's people had told me that it might vary from across the state. Some companies might not want to offer it in Representative David's district where they would in yours. Is that not true?
The point, though, is that you can, well, and actually, in David's district, that could throw everything off. But if you can literally, on your iPad at a public library, find some place that you can have access, you can have far more access to competitive online health insurance options than you've ever had in the history of Minnesota.
So under this bill, you're saying everybody in the state has access, will have access to the same insurance policies?
Put it this way, my aim would be to have that be the case. I suspect that the reality is that we're not going to be there on day one, but it would certainly be my aim to get as much access to all available options that people can possibly have. That's the whole point of having a very vibrant, competitive marketplace.
I think that it's a fair point that not every single plan will be a statewide plan. It'll have their own networks. But there will be a framework for an essential health benefit set and, a basic set of requirements that every plan will need to conform to in order to play on the marketplace. And there will be good plans offered in every region of the state. That's going to be something we'll have to work on diligently as we craft this bill, and I will be watching carefully to make sure that rural residents have the ability to select from a range of plans. One of the things to keep in mind is that with the federal subsidies that are available, our greater Minnesota residents are often those residents of Minnesota that are under 400% of federal poverty level and have the advantage of the federal tax subsidies available to them. They're going to be a very attractive market for the plans to develop good, robust access to. So, I mean, we have some really valuable tools that haven't been on the table before to encourage plans to step forward and make sure that everyone in the state has access to a plan designed around the individual and our families.
Representative Abeler said something, I think it's $1/3 billion this will cost. Is that federal money? Is that state money? I guess basically how much is this going to cost us?
I'd be happy to welcome Representative Abeler as well, but the anticipated cost in Minnesota will come out of a withhold from premiums. It's anticipated to be about $25 million. And the anticipated savings for Minnesota families is in excess of $1 billion. The anticipated savings for small businesses and businesses generally is in excess of $150 million. Much of that is as a result of federal tax credits, which one can only access if they are using the online competitive health insurance marketplace that we will hopefully have set up by March. And with that, my colleague, Representative Abeler.
Well, I think I'm right on the math. April can correct me if I'm wrong. I've been listening to her and tried to memorize all the numbers. It's $332 million between the beginning of this and the end of 2016. That's $240 million in federal grants that have accumulated over the time, and then $92 million the state has to come up with for 2015 and 2016, and it's something like $56 million a year after that for the cost of running the hardware and the network and all this stuff so the rough cost of this is $56 million a year ongoing.
But the idea is that the state share will be covered by a surcharge on premium costs, on premiums purchased through the marketplace?
It's not a surcharge, though. I'm sorry. Go ahead. In the bill itself, what we've indicated is it'll be up to a 3.5% withhold. So if whatever you spend on premiums, there could be up to 3.5% of that withheld to run the operations of the exchange. It bears noting, by the way, that the federal, if we allowed for the federally imposed option to occur, that is an arbitrary 3.5%. We believe that ours is going to be roughly 2.5% or less. So this will actually be a cheaper, less expensive option, running it through our own Minnesota-grown version.
But you expect that to cover the entirety of the state's share of paying for the exchange?
There's and April is here. April's been is with the exchange. We've had federal grants totaling $70-some million. We've got another grant application that we hope will be about to be approved that'll take it to an excess of $100 million. So the federal government is subsidizing most of this to get us up to the point where we're running.
And the withhold is just for operating, not for establishing the exchange?
There will be, prior to it getting into operation, there's up to 3.5% on premiums that would be used to put in reserve, so that we'd have that to be able to run up as of, I believe it was January 1, 2015, and it's in the bill, Don. It would then be on the premiums. It would be a withhold on the premiums themselves.
And at some point, will the state be paying after the federal money's gone, be paying some every year to run this?
Well, the expectation is that we will not be having a general fund expenditure, that this will sustain itself. But we'll see what the legislative process provides.
Let me just do the math. I like math. So up to the point of when the thing gets through with 2014, we'll have spent $240 million all federal on this. And that's the net. And the state has to pay $92 million net between now and the end of 2016. And the ongoing expense is $56 million a year, which is hopefully covered by this 2.5% assessment on the health plans, which would be all the health plans sold in the exchange. What excites me about this, 2.5%, the feds look like they're going to be north of 3.5%. 3.5% is a buy down, not total cost. It could be 4 or more than 4%. So my interest is if we can get it a 1.5 below what everybody else is paying in Wisconsin and other places, it's a good thing.